When people come in for their consultations, we always want to talk about what size they want to be. Now, I have a lot of people that maybe they come in and they say, I have a good friend who had 350cc implants and that's what I want. Well, choosing size of implants is not as simple as that may be. So when I always talk to people, there's a number of factors that come into play for us to be able to sort out what you're going to look like when it's done. Some of that is the number of cc's of the implant, but there's also factors like the amount of breast tissue that you start with, where we put that implant, whether it's under muscle or over muscle, and really kind of what your goals are for cup size and shape and appearance. So I try not to let you get too concerned about the exact number of cc's that we put in, but I really like for you to be able to describe to me what you want to look like. I frequently ask people to bring me pictures of things that they think look pretty, and that way I can look at that and be able to say, okay, maybe your idea of a D cup and my idea of a D cup are different, and so it helps me be able to reconcile some of that so that I can make sure that I meet your needs more effectively. Now, when I get to surgery on the day of your operation, I create the space for where that implant's going to be put. And then once I do that, I put in a sizer, and I use something that's kind of like a single-use throwaway saline implant that I start just filling it up to see what your body's going to look like with 200 or 300 or 400 cc's or anywhere in between or beyond. And that lets me be able to get some visual feedback of what your body's going to look like. And once I see that that looks like what you've described to me or the pictures that you've shown me, then I know exactly how many cc's need to be put in to make you look like that. I take out that sizer, I throw it away, and I open up a breast implant that's that size, and then I can put that in so that I know that you're going to have a great outcome, you're going to have your expectations met on what you really want to look like when surgery's finished. So I think that really gives us the best way to be able to get a good option for you without you feeling overly burdened about choosing a number of cc's of your breast implant.